Hi guys, all right, so I'm Dr. Ubongu Duffy and I am one of the consultants in charge of the Calabar Addiction Recovery Program. We help people handle alcohol and drug addictions and other addictions, gambling, porn, sex, food, and the like. So the Addiction Recovery Program is a 3 months based program. Usually we do 2 months inpatient and 1 month outpatient, but we know how things are. People prefer outpatient. So we tend to um, target 1 month inpatient and then 2 months outpatient. But ideally, for the best outcome, it's preferred to do 2 months inpatient and 1 month outpatient. So the aim is to achieve the clear mind. Once you achieve the clear mind, we know that, okay, yes, you have all it takes to overcome the addiction. Now, what is the clear mind? We represent the clear mind as a mental helmet that has an upper part and a lower part. The helmet basically is the knowledge that you have at the end of the program. Okay, we also have gloves. There's glove one, the first glove. These are mental gloves that are represented by things. Okay, so you must be able to put on a first glove and a second glove. The first glove, these are skill based structures, and the second glove, these are physical structures. Now, this conversation will be more about the second glove, that is the physical structures. Okay, so let's look at the helmet. Now, the knowledge that you're supposed to have at the end of 3 months is represented by the helmet. This means that if you don't have the right amount of knowledge or the right mindset, you cannot be said to have gotten the helmet. And without the helmet, I don't know what you're doing in the program. Okay, so the helmet has an upper and a lower section. The upper section, basically, we are measuring that you have been able to watch at least 10 of the videos within the program, and each video comes with an assessment, and you have completed the assessment. Sometimes these videos are repeated, but a minimum of 10. So if you have done up to 10 videos and done up to 10 assessments, then you know that you have the upper part of the helmet. And by the end of watching these videos, you would know that you should identify your triggers, you should avoid your triggers, and cope with the craving self. Now, this is just knowledge, so you know this. All right. So the lower aspect of the helmet is still knowledge, but it's mindset. So the first mindset says that I know I will relapse tomorrow if I abandon my structures today. Second mindset says that when I relapse, I don't have time to be feeling sad or guilty. Instead, I must use my structures immediately to get back into the recovery path. Now, for the mindset, you know you have the mindset when you have memorized this. So you can say this, mindset one and mindset two, without looking at what is written. So you cannot memorize it, your lower part of the helmet is lacking, and you do not have the helmet, and that means you have been wasting your time since you got here. So we would assess you, okay, can you tell us the mindset one and mindset two, so you know it by heart. It means that the lower aspect of the helmet is there. The knowledge will check, okay, how many videos have you watched? How many assessments have you completed? Do you know you should identify your triggers, avoid your triggers, and cope with the craving self? If yes, then you have the complete helmet. And remember, I said that the helmet says that you don't have time to feel sad, but you would use the structures to get back. The structures are the gloves. So the structures are represented by glove one, which are skill based structures, and glove two, which are physical structures. How do you get to put on your first glove or have your skill based structures? The first thing is that you know, okay, fine, I'm practicing identifying my triggers, I'm practicing avoiding my triggers, I'm practicing handling the craving self. So basically, you are practicing the knowledge that you have. The helmet is the knowledge, the glove one is the practice of that knowledge. So for the first aspect of the practice, you're practicing identifying your triggers. This means that you are intentionally doing what they call updating your trigger check. The trigger check is a form that we give you while you're an outpatient. It helps you identify your triggers. So you have experienced trigger situations and you now have opportunity to write it in a particular manner. There is a video on that, so you should have watched the video and know how to update it. The number two, you are practicing POD, participate, observe, describe, on urges that make you engage your triggers. So if you're in the program, you would know about it. So you are practicing these two things, and then this is evidence that you are practicing identifying your triggers. Number two, you're practicing avoiding your triggers using goal setting and goal chasing. This means that you are too busy to be engaging your triggers. You don't have time to even come across your triggers. Then you have mastered problem solving because you have participated in the exercises. You have mastered assertive communication because you have also participated in it. You have practiced radical acceptance, and you have learned how to modify your routines and your environment. And you have learned the term alternate imagery that is used on trigger situations. So you have mastered these things. By mastering, it means that you are engaging in the practice. We assess all of these things. We'll check your workbook, we'll check your notes, we'll check your assessments, we see where you have engaged in these exercises. If you have not practiced avoiding your trigger. Lastly, you have practiced handling the craving self using mindfulness routines. These are 1 week duration routines, certain things you do, breathing exercises, physical exercises, you do journaling, you do thought observation, and you do goal engagement. These activities are scored. If you fail it, if you don't engage it, you cannot be said to have practiced handling the craving self. Okay, so when you have done these three things, when we have scored and rated you, we know, yes, you now have the first glove, which is skill-based structures. The second glove are physical structures. To have the second glove, it means that number one, you have persons who are primary and secondary accountability partners. I'm going to explain what that is. Number two, you have certain places that you can go when the craving self comes. These places can distract you. These places are places that you can go to recover. We'll explain that. Number three, you have certain activities that you can engage in. The activities are either fun and or purpose driven. These activities would be used to help when you have cravings, when you're emotionally troubled. The activities will help bring your emotions down to normal. The activities will also help distract you till the craving self has gone. So I want to focus on the physical structure, my accountability partner or AP. There are two types of AP. There is the secondary AP, which would be your family members, the person that brought you to the program, the person that admitted you, all right, the person that referred you to us. That is your secondary AP. So they are mainly family members or very close friends, but mainly family members. The primary AP can be a very close friend or an intimate partner or a wife or a girlfriend, somebody who is very close to you, a buddy, that's the difference. So what do we need to know as an AP? Cannot be an AP unless you have done certain things. Without doing these things, you will not know what to do. You just be AP for mouth. Okay, so you need to have an idea of what to do. The first thing that you have watched 3 YouTube videos on Ubong Udofia 3525 on YouTube. So go to YouTube, type a username, and you'll see 3 videos. The first video is an alcohol and drug addiction rehab program. The second video is how to close the gates that keep dragging you back to addiction. And the third video is what you need to know in order to overcome alcohol and drug addiction. Now, by the end of this video, you would know about drug addiction. At least you would be educated. The number two, you would understand what triggers are. People will just say triggers by mouth. They don't really know what it is. The number three, you would appreciate the concept called craving self. It's important you understand these three things before you can be an AP. If after watching this video you still don't understand, let the client take you through each of these terms: drug addiction, triggers, and craving. Now, the second thing that you have to do or know as an AP is that the client or whoever is participating in the program or the patient, they have taken you through their workbook. And to be very specific, we care about the information in the workbook about their triggers. So they are taking you through page 5, page 6, and page 7, and it is compulsory that they take you through this. So when they're taking you through these 3 pages, you would know about their specific triggers. You will know about identifying their specific triggers, and you'll understand what the craving self as it relates to them even better. You will now know that there are certain things, places, persons that they should avoid. Then also they will take you through page 11, page 12, page 13, and page 14. So people and place triggers. That's week 3. Usually this people and place triggers is compulsory for the primary AP. It's recommended for the secondary AP because sometimes your family members might be very judgmental. Okay, so it's more comfortable when you take your primary AP through this. It's compulsory. So for your primary AP, they must go through page 5, 6, and 7, and page 11, 12, 13, and 14. For your secondary AP, like your family members, they must go through page 5, 6, and 7, and it's recommended, not compulsory, that they go through page 11, 12, 13, and 14. So page 14 basically describes people and place triggers. They would write, you will see their documentation. It's very detailed. It would show you how they have decided to avoid and handle certain persons that when they come in contact with, they have cravings and they go to use drugs. Certain places that they go to, you know those particular places that they should not be there. If you are seeing them with these people or in these places, it means that they're not serious about their recovery path journey or they have left the path. So you need to know these things as an AP. So they must have taken you through these things in their workbook. If their workbook is empty, well, you have wasted time in the program. Another information that you must know as an AP is you must have looked at the list of the client's telltale signs. So every participant in the program would write down how you would know if they have gone back to drugs. Like this person here wrote, I would have intense isolation for no good reason. I would lie about my sleeping habits. I would have swollen eyes and my eyes would be red. I will be demanding for huge sums of money. So the AP has gone through this list. And if you observe the client doing this, it means they have gone back to drugs. So if you have not seen the list, ask them for the list. Ask them to show you the list. They must not leave the program unless they have shown you the list. So in order for you to be relevant as an AP, you must participate in the mindfulness routines. It is compulsory for the primary AP and recommended for the secondary AP because sometimes secondary APs, family members might be old and they might not like it. But this is important because as an AP, you now become familiar with what methods they are using to handle the cravings. Okay. The number 2, as a secondary AP, you will be getting information in your participation in the program activities. If there's an issue with the time they come for the program, if there are issues with the time that they leave the program, if there are issues with completing of program tasks or assignments, you would get to know, you will get to receive information. Also, if they are skipping sessions without any reason, we would reach out to you because it usually means that they have left the path. Okay, sometimes clients want to use the program as an excuse. They say, I'm going to the program, meanwhile, I'm going somewhere else. So the AP has to be in the know. So this would be your responsibility. So the team will reach out to you if you are an AP. All right, the last thing that as an AP you would need to do is you would need to be aware of the client selected 6 month and 2 year goals. You'd also need to be assisting in one way or the other to aid the client in moving forward to get his 6 month and his 2 years goals. Now, this is seen on page 4. Looking forward, what do I want for myself in 6 months and in 2 years? And this is also seen in page 20. So before they leave the program, those pages must have been filled and completed, and you have an idea of their goals. Now, why is this important? The end game of the drug program is not just to make the client stop using drugs. We go beyond that. Okay, After you have stopped drugs, what next? The drugs were an issue because they had prevented you from meeting certain goals in your life. Now you have stopped the drugs, it doesn't automatically mean that you get those goals. So we would guide you, assist you, and you would get those your goals. All right. Maybe part of your goals was school, was business, was relationship, was reconnecting with your family members, was traveling. We'll work with you in actualizing those goals. This is the recovery path to get your 6 months goals, to get your 2 years goals, and then to stop using drugs or any other addiction that is preventing you from getting those goals. So you cannot be an AP unless you are aware of all this information and you have participated either as a primary AP or a secondary AP. Now remember that secondary APs are family members, while primary APs are close friends, intimate partners, and the rest. Now, as a client in the program, if you do not have a primary AP, your secondary AP would become your primary AP. So your parents, your siblings, family members would become your primary AP, and you might not like it because usually secondary APs are very judgmental. They are very judgmental, while close friends, intimate partners who are not using as APs are likely to be very understanding. Okay, now there are other things that are not written down here, such as random drug screens. We do at least 2 random drug screens per month. Okay, this is also a physical structure and it's a way to measure your accountability and keep you in the path. Okay, it's not meant to catch you, it's just meant to keep you in the path. All right. There'll also be support from the team members, and this support would mean that there are certain requirements from your secondary AP. If there are questions, you can reach out to me via chats or via my social media page. I can give you more information. Have an amazing time in the recovery path and be a very efficient accountability partner. It's by force. It's by force, like it's by force.